Welcome everyone to the Improvement and Innovation Showcase. This showcase, we are actually applying a lens to the CEIH, so to ourselves, and our reflections of our work in 2024. My name is Malu. I am a project manager here at the CEIH and a network advisor, and I today will be holding the showcase. Before we start, I'd like to acknowledge that the land we are meeting on today is the traditional lands of the Kaurna people, and that we respect their spiritual relationship with country. We also like to acknowledge the Kaurna people as the custodians of the Greater Adelaide region, and that their cultural and heritage beliefs are still as important to the living Kaurna people today. I would also like to acknowledge that some people might be joining from other countries and paying my respects to their elders. Now, this is our 14th Improvement and Innovation Showcase. The Improvement and Innovation Showcases are 40-minute sessions, and they're set up to bring people together from across the system to mostly share improvements and innovations, to highlight why those are needed, how the change occurred, and what the impact of those innovations have been. This is so that we can actually learn to create meaningful connections and continue to do better in healthcare. So that then brings me to inviting everyone to share. If you have a story to tell, to reach out to us with anything from successes to learning or topics you would like to explore. Our contact details are on the screen. So yeah, we would like to hear from you. So our vision is together creating health and prosperity for all. And today's session really ties in with our vision. And I'm highlighting the word together here because as a leading agency for healthcare excellence and innovation in South Australia, we recognise that it takes partnerships and collaboration to create a better system. And as with anything, you do not innovate alone. We need partnerships. I've also mentioned the word learning, which together with collaboration and empathy are our key values here as an agency. Learning includes celebrating successes, learning from failures, learning from each other, and understanding our impact. So for this reason, we're really hosting this last showcase as a reflection of our year, and we're excited to share our successes, learnings, and impact. A little bit on housekeeping. So our chat is currently turned off. If you want to start a discussion or ask a question, there's a Q&A tab at the very top, which you could go to and put your questions in. The presentation will be recorded. The Q&A session will not. So once we finish our presentation, we will stop recording. Your mic and your cameras are turned off by default. And during the Q&A session, we invite you to actually turn your camera on if you feel so, because we always like to know who we're talking to, which would be nice. And if you have time, please complete our feedback poll. That will be great. Today, you'll hear from our Commissioner, Professor Keith McNeil, and his reflections on a year in the role as our Commissioner, and how he's created connectivity and collaboration and has driven some key projects. Then we hear from our Executive Directors, Hardin and Katie Billing, who will provide an overview of their respective streams within the CEIH and the projects and work that they've been undertaking this year. This is followed by a panel discussion with project managers here in the CEIH, highlighting their successes and challenges and learnings from their projects. So there'll be time for Q&A at the end, at which point we will stop the recording, like I said, and if you have any questions, please, in the meantime, post them in the Q&A section. I will now hand over to our Commissioner, Professor Keith McNeil.
Thanks, Malu, and good afternoon, everyone. It's great to be able to talk to you towards the end of 2024. Where has that year gone? Oh, my goodness, it's flown by. So I'm going to take you through sort of my reflections on 2024, what's changed. I've been in the role now just over a year, and again, that's flown by. And one of the things that I'll say straight up is that as part of this, my instructions as to how to run this session, I was asked to take control of the Teams thing. I think that's the first time I've been trusted by my team to take control of anything since I've been here. So that's welcome. So look out, careful what you wish for. So my year in review, I'm going to talk about 3 things and then develop some themes around that. Strategic direction, how we bring people together, and what impacts we've had, or some of the impacts that we've had as we've moved on. So first of all, when I came in and thought about strategic direction, it's really important to me, and I think it's important to everybody who works in organisations like health, any health organisation, to have a framework in which to operate, in which you can reference back so that you know where everything that you do relates back to in terms of what we're shooting for, what we're trying to achieve. And we did this in a collaborative way across the organisation, and also sought some external thoughts on what had worked well for CEIH up until my arrival, and what maybe didn't work as well or could have worked better. And we arrived on these 5 pillars or tenets, if you like, of what CEIH was about, what's in our DNA. And the first one there, as you can see, is equitable access to care. And I will start here by saying that Malu gave an acknowledgement of country. And for me, this is one of the key issues in terms of where we look at reconciliation and where we look at closing the gap, how we enable equitable access to care to everybody. Our First Nations population is certainly feel the brunt of this, but it's not by no means related to them specifically. But certainly it's a focus for us in how we enable people to access high quality care at the same standards right across the state. And we're all aware of the geographical challenges to that. So that's a lens that we apply on what we do, i.e. to say, how do we design, or when we design systems, when we embark upon a project or an initiative, how is it, or is it going to improve equity of access, equity of outcome, equity of care, etc., etc. So that's one lens. Consumers are at the heart of all we do, and we have a very active consumer group that are connected intimately with the work that we do across the networks and across CEIH. And of course, it's self-evident that what we do in health is to do with consumers and patients. That's why we're here. That's why we exist. It's why health departments exist. It's why governments put taxpayers' funding into healthcare, is so that we can deliver better outcomes for society, for consumers and for patients. And part of that intimate journey with consumers and patients is to understand how they can be more actively engaged in their health journey. And so that is another lens that we apply, is that are we doing things in partnership and collaboration with consumers, and how are we helping them in terms of that empowerment journey? How are we engaging them in both the discharge of our service delivery, but also in the design as we move forward? What do they actually want? And that comes around to the equity thing as well. The third one you'll see there is environmental sustainability. This is a particular focus for me, being a greenie at heart, and in my younger days I did chain myself to a tree to stop it being cut down. Unfortunately, it got cut down after I unchained myself to go and do a night shift in the ED department, but be that as it may, the environment's really important to me. My generation, I'm older than probably everybody on the call here, I'm sure, but my generation has been responsible for wrecking the environment and setting it up for failure. I was privileged enough to have dinner with David Attenborough when I worked in Cambridge, and I was inspired by his passion around environmental sustainability. I'm fond of saying that healthcare is responsible for 6% of global carbon emissions, and everything we do in AI is responsible for adding to that. And so one of the things we have to do is deliver value from everything that we do, and apply that lens so that we can ask ourselves, what is the impact on the environment, or what is the impact on climate change of what we are doing here? And if there is an impact, are we providing value over and above whatever that impact might be? Nothing happens without workforce. And so workforce sustainability is critical. And looking at new ways of working, looking at ways that we can empower our workforce, looking at ways that we can improve their efficiency and their productivity. And of course, digital comes into that considerably, but also different models of care. How can we provoke conversations about how we do things differently, which is in the DNA of CEIH, doing things differently, innovation. And then fifthly, how do we improve economic prosperity with what we do? Because a prosperous economy is a healthy economy, and a healthy economy, a healthy society is a prosperous society. So it works in both ways. And so also we apply that lens to say, how are we contributing to the improvement of the social gradient across the system? How are we narrowing the gaps? How are we improving socioeconomic status? And how are we contributing to economic prosperity through our impact on health outcomes? Bringing people together is really important. Nothing works without bringing people together in health. Health is a complex system, just like the human body. You know, I mentioned take control. Well, there's nothing that controls the human body. The liver and the kidneys, the heart and the lungs, they're all equally important. And so is true across a health system. And so critical to what we do is how we network and how we facilitate and enable networks to come together so pivotally. And we've done that in three ways. We've brought together, or bringing together, it's always a work in progress, but we're bringing together the work that HCEC does at an executive corporate level with the work that we do on the clinical coalface through the clinical networks. And that's by bringing that group together and having discussions at the clinical council level. That is a work in progress, but I expect that will see us align the system much better from top to bottom and bottom to top, again, around the initiatives that we undertake and the opportunities we surface. And of course, the statewide clinical networks are pivotal to that. We're privileged to host the statewide clinical networks, and we'll be motoring on with their workload as we go through into the new year and beyond. And the network at point now that we've focused on will be the South Australian Comprehensive Cancer Network, a real opportunity for us to showcase the value of bringing people together to improve the outcomes of people with cancer and also to improve the equity of access around that. What are the impacts that we've had? Just very briefly, well, obviously our impacts have been recognised, that we've been given the opportunity to guide the implementation and the running of the cancer network. We've come up with a framework for highly specialised therapies. These are things that cost a lot of money. How do you consider that in the concept of utility and equity? And CAR T cells, which you may know about, which are used to treat cancers, are right at point because they're very expensive and only a few people will benefit from them. How do we incorporate that into the wider system where there are so many demands on healthcare? Similarly, for robotic-assisted surgery, how do we enable equitable access to surgery? How is it evidence-based? How can we showcase the evaluation? We're pivotally involved in ambulance ramping. It was one of the first things I got involved in when we came in, and we focused particularly on the flows of mental health patients. And we've certainly been influential in describing those challenges. And of course, this is all underpinned by data and information. And I now am delighted to hear people talking about patient journey maps or health journeys are being mapped out in individual episodes of care, how we build virtual registries, and how we're inculcating ourselves in with the national agenda. So they're just a few highlights of some of the things that we've been able to get involved with, achieve and change the dial on over the last 12 months. And I look forward to motoring on even more avidly in the next 12 months. And with that, I will hand over to my executive colleagues, Tina and Katie.
Thanks very much, Keith, and thank you to the team for setting us up so beautifully for this session today to have the opportunity to showcase for you. Both Tina and I guess, are just going to do a bit of a really high level quick overview, and by no means be able to touch on all of the individual achievements of our teams from the last year, but really just wanting to pick up on how we work to be able to describe and showcase that for you in the context of how we improve and innovate. Excuse me. If I can pick up then from a consumer and clinical partnerships point of view, Keith's focus on consumers or patients at the centre of everything we do. And I certainly think that the way that we work with our statewide clinical networks is really an attempt to be reflective of what happens at the bedside or at the point of care. We certainly, Keith talks about bottom up. We could also conceptualise that as being from the point of care up. And so what we know is that excellence happens in the interaction between the person providing the care or the treatment, the diagnosis, and the person and the patient and their family. And so when we are able to work with our statewide clinical networks at a system level, really what we're doing is replicating that connection between the consumer and the clinician, and recognising that behind those clinicians sit the health service organisations and all of the support teams that make that happen, but really keeping a focus on that being the point of where excellence occurs. In doing that, we're able to identify through those networks and through those connections the opportunities that are ripe for the picking in terms of where we can make a difference in the system. And I can highlight certainly where we've been able to work in partnership across different organisations in South Australia to be able to deliver better. Firstly, I would just like to highlight something that we've done this year that you may not be aware of, and that's with regard to personalised care and precision medicine. So something that we took a leadership role in this year that was really important to us was to start to look at the blueprint, if you like, the roadmap for personalised care and precision medicine for South Australia. And so at this stage, we've published a document that talks through what that looks like, and we're starting to align alongside of our strategic lenses that Keith just walked through, starting to align and work towards being able to deliver on that roadmap, but also work to enable our partners who are delivering other elements of that as well. So there's key things that we can do by bringing people together or by smoothing the road, but there's also things that our partners and other agencies around the state need to do as well. So not sort of suggesting that we're in control of that, but that more we've laid out the roadmap and the blueprint for that, and that we're working to enable the whole system to achieve personalised care and precision medicine, because ultimately that's how we'll achieve those strategic lenses across many of the areas. In terms of our goal and the reason we bring people together and why we partner, it is really important that we recognise that the CEIH is working towards better experiences and outcomes for everyone. And in doing so, we've had partnerships that have focused around system level pieces of work, like Keith mentioned, the highly specialised therapies framework. We've partnered with the university, with the Caring Futures Institute, to deliver a cancer navigation framework. We've had the opportunity to work with local health networks in partnership with emergency nurses in South Australia to implement the high RAID model, which has been a really exciting opportunity to patient up or ground up, be able to look at standardising care to reduce variation. We're really excited to have seen the implementation across Metro and Barossa Hills Fleurieu Local Health Network, and early next year we'll be working through the remaining local health networks through regional South Australia. So that partnership with those local health networks and the nurses on the ground and some key emergency nursing leads, but also the University of Sydney. I'd also call out the opportunity that we had a few months ago to host the Cancer Symposium in partnership with the Hospital Research Foundation and the Cancer Clinical Network. We saw 180 people gathered for a day with the opportunity to review the latest in cancer care, cancer system management, and certainly cancer evidence with national and international speakers. So a fantastic opportunity for us to be able to bring people together. Keith talked a little bit about environmental sustainability, and certainly one of the partnerships that's been really exciting this year has been the opportunity to work with Nicola Spurrier's team and Dr. Kimberly Humphreys on the previous showcase to this one, so the Environmental Sustainability Showcase, which was a fantastic opportunity to be able to start to create the catalyst for a systematic approach to how the health system in South Australia addresses environmental sustainability. And that was really exciting. Finally, just not to miss the opportunity to link back to being able to look at it being about better outcomes and experiences for everyone. I would acknowledge that it's been critical for us to look at workforce and workforce wellbeing, and I'm aware that Isla will talk more about that in the panel session shortly, but workforce being front and centre at a system level. And then finally, patient reported measures, or PRMs, and our implementation on behalf of SA Health across South Australia. The highlight, I think, in addition to the implementation of patient-reported outcome and experience measures across the system, has been the work that we've done to agree a generic PROM, so a patient-reported outcome measure that we're really excited to tell you more about next year. And this will be a real key enabler to being able to put what matters to patients at the centre of everything we do.
Thank you, Katie. And so my name's Tina Hardin, and I am the Executive Director of Clinical Informatics and Innovation. And you've heard a theme run through Keith and Katie's presentations about people bringing at the centre of everything that we do, and how a lot of the work we do is about bringing people together. And when I reflect back on 2024, I think that's been a really strong element of a lot of the work we've done, whether that be through strategic work or through building, looking at governance and looking at technology enablers, and through innovation. So thinking through those elements, this year we've, in the innovation space, we've launched our innovation model. Please get online, Google CEIH Innovation Model. Fraser will talk more to that, I'm sure, which has been very exciting. But we've also partnered with the Young Professionals Group to lead an innovation workshop and conference, which was, I think, the highlight of many of our years. And Lou played a key role in that as well. We also supported the allied health team in the department to lead their innovation symposium, the first inaugural one that they've done, which was exciting to be involved with and help support them there. So again, working in partnership and collaboration to help drive some change in the health system. Through the informatics space, we have been really working on building some foundational pieces. And again, though, there's lots of hard work being done by the team, but what has actually happened is that has formed into collaborations and partnerships and collaboration with other agencies, including the Department of Health and Wellbeing, to look at how we create those foundational pieces that are enabled for more than just the CEIH, so sharing and giving back to the whole sector. So some of those examples is what Keith talked about in terms of patient journey, being able to understand at an individual level the health interactions, being able to understand at a hospital or health intervention level, and then being able to understand at a system level, which enables us to really build a picture about the patient, but also about the health outcomes of the system. But one of the challenges there is that we're only ever looking at it through our lens. And so one of the opportunities that we really want to push, we've been pushing hard on in 2024 and will continue to push in 2025, is how do we build a whole picture, holistic picture around the patient and around the health system, so that we can really move towards that personalised and precision care that we've talked about. We have also done a whole bunch of work looking at digital twin and simulation, so being able to support the health system to and build some foundational pieces there where we can choose more. Choose more wisely, or be better informed about which interventions are going to have an impact on the health system before we actually invest in delivering those. And then through that work, that's been leaning into the research space as well. So we've actually got quite a big footprint in the research space on a number of different projects, and really leaning, again, sharing that work with the other work we do with the statewide clinical networks and building on to clinical variation. And we've done lots of work this year in sepsis and COPD, pneumonia, and we'll start to bleed into heart failure and other areas. So really looking forward to 2025 and really excited about some of the other programs of work that we've got, including the SACAM project that we talked about. I'll pass back to Lou in the head office to talk through the next section.
Thanks, everyone. I've magically appeared with the panel here in Katie's office. Hopefully everyone can see and hear us. So I'm joined by 4 people from the CEIH. So we'll do a quick round table to, just identify who you are, what role you're playing here in CEIH, and what in your line of work the problem is you're trying to solve. So I might just go left to right.
Sure. Yeah, I'm Professor Kevin. I look after the innovation portfolio here at the Commission. I think ultimately the problem we're trying to solve is to mainstream and systematise innovation. And we know innovations occur spasmodically, often opportunistically. What we're trying to do is to make it a BAU for the whole system. So we do that in a range of ways: resources, training, collaboration. That's probably a main focus.
Thank you.
Thanks. So hi everyone, Isla Voigt. I'm a Manager of Workforce Wellbeing Partnerships here at CEIH. Ultimately, what we're working towards is a pillar of workforce sustainability. Without our workforce, we don't have a healthcare system. And I guess our piece of the puzzle is really looking at the design of work and making sure that our system not only protects the health and wellbeing of our workforce, but also promotes and helps everyone to thrive in their professions.
And yeah, I'm Georgie Zabo. I'm a data scientist here in our clinical informatics team. And I guess, data is one thing that, as Keith loves to say, underpins, everything that we do and that we can use to kind of address all of our kind of issues. But particularly unwarranted clinical variation and equitable access to care is definitely a big part of our work.
I'm Michael Osborne. It's my day job. I work as a haematologist both at the Royal Adelaide, where I look after the Youth Cancer Service, and also work at the Women's and Children's Hospital. Here at the CEIH, I'm the lead for the Cancer Statewide Clinical Network, and probably it's no surprise to any of you that the problem we've been working on is trying to collaborate with others across the broader network to improve outcomes and experiences for people with cancer, their families and their supports throughout the entire cancer journey.
Yeah, big problem you're trying to solve. I think we've heard a few times about workforce wellbeing and that also being in our strategic directions. So Isla, for you, the CEIH has been investing for a couple of years now into a culture of workplace wellbeing, which, as we know, is so important. Where do you feel the system has made the biggest gains in this space?
Yeah. So, I mean, reflecting back, it's been 2 years, about 2 years since we published a discussion paper publicly, which pulled together all our findings of the current state around workplace wellbeing across the health sector in SA. And also where some really key areas of action that were really foundational that perhaps were missing across the system. So it's really great to see that objectively we've made some huge gains against some of the really big, what we call as boulders, but foundational pieces of work. So, for example, one was around, there was no coordinated action around workplace wellbeing at a system level. And we now have a really active group of CEOs that meet very regularly to look at all those system level factors and drive action in that space. That's been, in existence now for 2 years. There was no consistent platform looking at how we're using our data to give actionable insights around our workforce. But also using that to actually drive action to improve them and track that. So now we have a system-wide implementation plan that's about to be rolled out that's been endorsed by all the local health networks. So that's really exciting, critical piece that was missing around consistency and using our data better. Another one that was identified was around capacity for workplace wellbeing strategically. So not just on the ground in terms of, employee assistance and supporting individuals, but actually at a strategic level. There were no dedicated roles or very minimal in health services across the state. We're now seeing the majority of the metro LHNs having really strategic roles, which is great, investing in those, and quite a lot of the regional as well. So that's huge gains across the system to really set those foundational pieces to set us up for the future.
Yeah, and so important for a workforce that's currently quite challenged and pressured and very exhausted.
Yeah.
What challenges have you found in your line of work?
Yeah, I think I acknowledge the things that are reflected on are the foundational. We still have a really long way to go. I think in terms of personally, challenges is that real strong sense of empathy of demand is there, staff shortages are there. That's not going away anytime soon. So our workers on the front line are still bearing the brunt of that. So I think for the challenge is, despite this really strong increased recognition of the importance of workforce wellbeing, workforce sustainability, the actions to go into place to remedy the design of work, the systems of work that are actually going to change that tend to fall down the bottom of the priority list when things get busy. So I think for us, the challenge is, how do we continue to mobilise capacity of everyone? It's not just a people and culture issue. This is everywhere from clinical governance, senior leadership, you know, on the ground frontline managers to be working together to look at what are those key drivers that are impacting on job stress, burnout every day, and how can we continue to work towards those.
Yeah. Big work, big projects. Well done. Thank you, Isla. Fraser, I've heard a bit about your achievements this year in the innovation workspace. How do you know that the work that you're doing is making an impact?
Yeah, good question. I think for us, we have a very engaging collaborative approach. So what we're trying to do is, as we're designing and forming solutions, we've actually got the market and the industry on board with us. So we take very seriously their feedback. What is it that their perspective brings to what we're doing? It took us probably 12, 18 months to develop the innovation model. Since it's been in the market for a couple of months, its use is getting more prominent within the Commission. More of our staff are using it as a touchstone of what you might need to consider when bringing in new technologies or new innovations. We've also had a lot of really good feedback from the industry in terms of innovators who, in the absence of a whole state model for how do you progress in innovation, the innovation model has allowed lots of different personas and perspectives to come together using a neutral language that's not partisan by clinical expertise or even industry type. And I guess the best feedback is the demand for our services, that in the last few months, we're getting more and more contacts right across the system, looking for advice, looking for people they can speak to, looking for new ways of thinking about an old problem. We also have the resource adoption that we're seeing through our web traffic, that people are downloading the resources and actually using them and adopting them into their own business. Which has been a really good outcome for us, because we're getting some standardised thinking around what would be the most sensible, most practical, most efficient way of adopting innovation.
Amazing. So, and it sounds very similar to Isla, is that foundational level is what you're creating, that is that gap that currently is existing in South Australia. What are your hopes for the future for the next year?
I think to continue to see innovation as part of BAU, that anyone that's trying to change the way the system operates should be looking at it through an innovation lens, through an entrepreneurial lens, through a creative lens. That one of the challenges I think that we have in big systems is there's a traditional methodology that's used in project management or quality improvement. Innovation offers another way of thinking about traditional problems. So for us, it would be about people using the language more, people using the resources more, people seeing it as a legitimate scientific methodology for improving healthcare that goes beyond what we already know.
Yeah, thank you. And I think that will be helpful for those on the floor who are struggling with things, to actually have some tools to bring ideas forward and, like you say, just change thinking. Thank you. Michael, you work both, I guess, clinically on the ground as well as, with us in the CEIH. How do you see the work done by the CEIH is creating an impact for patients in the cancer space?
Sure. So I guess we've been undertaking several specific projects, as well as trying to work on some other wicked problems within the system. And I think one of the real challenges in cancer is, because it's such a big thing, there's always this risk of there being multiple silos. There's the silos of the LHNs, then there's the silos of support organisations outside of health, the silos of the universities. And one thing that we've tried very much to do is to try and break those down and get all of those individuals to be working together more, so that we can together try and improve outcomes for patients on the ground. And I think that if we look at each of our projects, we can kind of see that in play, in that one of our big projects is looking at care navigation for patients. We know that if a patient requires medical oncology, radiation oncology and surgery, often in different places, it can be very complicated even for a really competent individual. And so we hope that by developing really sort of personalised approaches to care navigation that will help patients to not only navigate the system, but help the system to work better together in that process. And highlighting the collaborative aspect of that even further, this has been a project together with the Caring Futures Institute from Flinders. So it's involved not just clinicians from each of these sites, but also the universities, patients themselves and so forth. So I think that that's a really good example of how we've tried to break down silos to bring people together. There's several other big projects that we've been doing. We've been trying to look at establishing a CAR T-cell program for South Australia. And once again, in this setting, we recognised that one of the barriers to a CAR T program was that here within the department, there were a number of areas who had skin in the game, but none of whom individually were completely responsible for this. So in recognition of this, we thought, why don't we develop a framework for evaluating highly specialised therapies, which then drew in commissioning, it drew in strategy and governance, it drew in the office of the chief pharmacist, as well as bringing clinicians into the room so that together we could try and work through this problem rather than just banging our head against the wall and thinking, why can't we make this work? So again, that breaking down the silos, trying to collaborate, bringing clinicians to decision makers in the department so that we could come up with better outcomes for patients. Look, there's many other examples that I could give, and perhaps we'll with subsequent questions.
Yeah, well, I guess a question popped into my head because you're talking a lot about opportunities. What opportunity is coming up that you're most excited about?
Yeah, sure. So probably the single most, the one that I'm most excited about is the South Australian Comprehensive Cancer Network, which I know Keith mentioned before. And this is an opportunity with the assistance of some federal funding for us to really lift cancer care throughout the state. And once again, it's an opportunity for us to not build a new silo. We're not going to be building a new shiny building where you can come and get your cancer treatment, but rather what we're going to be doing with that money is bringing together all of the current cancer experts from around the state so that we can improve what we're doing, so that we can start to do some of the things that the network's been wanting to do for a long time, and hopefully this entity will facilitate that. What it will also do is facilitate the implementation of some of the aspects of both the draft state cancer plan and the Australian cancer plan as well, both of which are really considered documents that have had input from a really broad range of people. I think if we can look at implementing some of those elements within our state, it will certainly make things a lot better for patients. I really should also say that a number of the things that we've been looking at doing, we couldn't have done without some of the other expertise from within the CEIH. For instance, one thing that we wanted to do this year was to establish a cancer nurses collaborative, and we'd heard from nursing staff that they felt that they didn't have a strong enough voice on the Cancer Network Steering Committee, and we wanted to elevate that. So to help that, we thought we'd build a nurses collaborative. And as part of that, they were very much trying to look at what are some things they can change in the system. And one thing that came through loud and clear was the issue of staff wellbeing. And we know that if staff are feeling good about their work, they provide better care. So Isla and her team were able to speak to our nurses collaborative and give them some really good ideas for how they could start working in that space. Similarly with proms and prems, we've got the PRMs group within CEIH, and we've had some projects, some pilot projects within cancer, which have really benefited from the expertise of the PRMs group. And I was very pleased that just last week we've had an invitation from November who are looking at rolling out pan-cancer PRMs for all of Australia in the coming years, and they've invited us to be part of their executive group there. So again, couldn't have done that without the work that's happening in the CEIH, and also couldn't have done it without the clinicians on the ground. So again, it's been a really nice coming together of clinicians and experts from here. And I guess just to wind up, I hope that in the process of trying to engage clinicians further, and draw them into this, that'll really set a really solid foundation for the South Australian Comprehensive Cancer Network. You know, by having things like the Cancer Symposium that Katie mentioned, where we had close to 200 people coming along, by having a nurses collaborative, by having a really engaged cancer network, I hope that will really form a solid nexus for creating SAGAN as it develops over the next years.
Thanks, Michael. And I think you've touched base on what we're kind of saying about how you connect people with the work that we're doing here on grounds. Because obviously when you're talking about impact, and the work here is we're not here to just be to do just that governance structural, like the CEIH also stands for that real on ground. How can we improve care? And any ideas that come forwards from networks such as Cancer and the Nursing Collaborative, we do always take on board, and we'll proactively help them move on. So thank you, Michael, for sharing. Actually, one of the things you mentioned was about care navigation, and the hardest thing, how complex that is. And part of that is supported obviously by data, what we need. And we have a data team here, of which Georgie is part of. So Georgie, for you, in terms of big data, what do you think has been your biggest insights gained from working in the data space?
Yeah, I think this year particularly we've been getting a lot of insights from our GenMed project that we've been working on, which is all about trying to uncover unwarranted variation in patients in general medicine wards in the hospitals. And then kind of once we can identify some of that variation, what can we do to kind of address that? And one of the kind of key things I've really been doing with that project that I've been involved in is a real clinician kind of led approach. So it's not just about us typing away on our computers in the background looking for problems we could solve. We're kind of going for more, well, why don't we go and talk to the clinicians and, what are their kind of bugbears, what are the areas that they see from the front line are, important to kind of address. And, we've uncovered, they have 1,000,001 different ideas, and that's been one of the challenges is kind of trying to uncover what we can discover, and then what we could kind of address. But it's been really successful. We've had like a lot of buy-in, done some workshops across 2 of the kind of major health networks that we've got here in Adelaide, and we're kind of getting towards the next kind of steps on now we've uncovered with Tina's favourite analogy of looking for needles in the haystack. We found lots of needles, and now we're trying to decide, which ones we really want to focus on, and can we build some analytics kind of tools or machine learning models to kind of address that variation, and what would that look like moving forward. But we're always really mindful that just because we can do something, does that mean we should be doing it? Especially, AI is very topical at the moment. So we're really keen on, if we're going to do something, what value is that going to bring? Is that actually going to make a difference?
That's amazing. And I think that's a key underpin, isn't it? And what you often hear is that, especially from data, is, yep, you've got all this data, all this knowledge, but it's actually, in fact, the people on the ground that want to know the impact. So for you, you've mentioned collaborating with clinicians. Like, how do you collaborate to make sure that it actually is valuable for them?
That's a very good question. I guess one sense, I'm lucky in the respect that I've got a clinical background, used to be a registered nurse before I did data things. So I've got that ability to communicate with the clinicians and kind of understand. And you need someone who can help unpick and kind of, we call it like a bit of a translator, someone that can translate between talking clinical to talking data. Both have lots of acronyms and lots of stuff. And sometimes it's the same acronyms used, but meaning completely different things. But just as well, making people feel like they're being listened to and heard as well. And, the issues are actually kind of being acknowledged and someone is actually looking into it. That's a big part of it as well, especially, as we mentioned before, people working on the front line, same issues day in, day out, feel like, no one else is really kind of able to or making a difference in that space. So we found that that's one of the biggest things that's helped.
Thank you. Thank you. That was, we only had a short time for the panel discussion, but thank you all.